came from very different backgrounds.
Be classy, be genuine, be grateful.
I wanted to help out and contribute and sort of give back to the people that had helped me.
Man, welcome to the intro. No need for introductions. All about the world and the world what we discussing. Where every single thought that we had came from something. So it's funny that we made it when we started here with nothing. Gotta open up your mind just to find out why. When you lost inside the dark, just gotta turn on the light. And no matter what you do, you never run from a fight. Because we fighting to be better and that's why we strive.
Hi, I'm Corey McCain, CEO of WeStrive, the #1 platform for personal trainers, gym owners, and coaches to both manage and scale their business. I'm your host for Why We Strive, where every Tuesday I sit down with some of the most incredible tech founders, investors, and creatives to find out how, when, where, and why they strive. Be sure you tune in every single Tuesday and check us out at whywestrive.com for more info. Now, let's get to this week's episode. Okay.
Okay.
Ready to go?
I'm ready when you are.
Let's
home
do
dog.
it. All right. Awesome. Call me home dog. Is that what
Yeah, that's what I said. That's what I
I don't know if I've been called home dog before. It's pretty cool. We got Sidney Collin here.
The best one yet.
The best one yet. Best one yet. Maybe the best one ever. We'll see how good it goes. So, do you want to quickly introduce yourself, a little bit about your background, and then we'll get into what you do?
Sure. My name is Sidney Collin. I'm the CEO and the co-founder of Oro Devices.
Okay.
We make mobility aids for people with mobility disorders to help people walk safely, independently, and confidently at home, so outside of the clinic.
Okay.
You don't want me to go too much into the company right now, just my personal background.
Yeah, we'll get into that in a sec.
Okay.
Yeah.
Let's see. My personal background, so I grew up in the Bay Area in California.
Okay.
I've always been obsessed with understanding how the brain works, how the body works, how they interact.
Mm-hmm.
And I studied biomedical engineering at Cal Poly.
Very cool.
And every side project that I worked on was in brain-computer interfacing. I was really, really fascinated in this whole concept. And I don't know how much detail you want me to give there, but I can share some details of some of the research.
Let's hear some details.
There.
I mean, I do not know anything about brain computing or anything like that, so feel free to say whatever you want. I won't understand it, but I will support it. Yeah.
So, I just think the brain is so freaking
It's
interesting.
very fascinating. I'm not
so
smart
cool.
enough to research it. Like I'm smart enough to know that I shouldn't be the one doing the research on the brain. I'll let you guys handle that.
But
yeah.
honestly, nobody understands how the brain works. That's what I love about it so much, is that you can get into this space. Like, I published a research paper when I was 20 years old because people don't freaking know how the brain works.
Okay.
And so somebody can come into a space, do research and analysis for 6 months and be able to publish a paper in a peer-reviewed journal article because people don't freaking understand how the brain works. It's amazing. It's so cool. And I think that there's so much to learn. Mm-hmm. And I think that we're at this place right now in the world where we have the equipment to be able to analyze brain signals in a way that we've never been able to before with the high signal to noise ratio. And then we have the computational power to be able to analyze large data sets, which is extremely important in looking at brain signals because you're looking at so much data that if I was only taking that and analyzing it on my computer for the research that I did, it would have taken me like a week to do a simple filter on the data that I was looking at. But because I could use parallel computing and cloud computing, it would take me a couple of hours. So anyways, cool. I'm like geeking out hard in an area that we're not even talking about.
I know, it's part of the podcast. Yeah, very cool.
But I think the brain is really, really interesting. And I think the brain space right now in the next 10 years is just, we're going to learn so much.
Do you think like the space is going to evolve into like us using more percentage of our brain?
That's a good question.
Don't we only use like 7% or something like that?
I don't know. Honestly, I don't know. I think what I tend to pay more attention to is like how we can work with the brain. So for example, like brain controlled prosthetics, like what paradromics is doing, I think is freaking so cool.
Okay, what is paradromics? Don't know what that is.
So Matt Engel runs a company called Paradromics here in Austin.
Okay.
He also started an organization called Texas Neurotech, where he gets all of the coolest people in the whole world aka neuroscience nerds,
Nice,
together
nice.
in a room. And he has, startups, he has investors, he has people from academia, he has people from big strategic companies like Abbott that'll come. And we all just kind of get together in one room and talk about how cool the brains are.
Very cool. Very cool. Okay. Well, I never have gotten that invite, so I'm kind of upset a little bit, but it's okay. I'll go to the next one.
Didn't you just say that you don't like to study the brain?
I was totally kidding. Yeah. What do you guys like? Big brain happy hours? Like, what do you guys call those? Like
Just Texas Neurotech. That's
Texas
it.
Neurotech.
Yeah.
Gotcha. Okay. Very cool. So was there a specific part of the brain that you were studying? Like, I don't know what the parts are, to be honest. Like, I know frontal, something like that. I don't know. Is that part of the brain? I don't know.
Yes, you have a frontal lobe.
Frontal lobe. Yeah, I know something. Okay, very cool. So what part of the brain were you studying, and like what does that brain part do?
Yeah. So originally I was doing a project while I was in school for St. Jude Medical at the time, now Abbott. Looking at deep brain stimulation for people with Parkinson's disease.
Okay.
And so I wasn't necessarily looking at a specific part of the brain. I was looking at the type of brainwave that we send and seeing if we can individualize that for each person rather than having just a standard type of pulse or size pulse that we send in the brain for everybody.
Gotcha. Okay.
So that was the first kind of project that I did in brain-computer interfacing. And then I took some time off of school actually, and I moved to France.
For 7 months.
For, 6-7
Got it
months.
right here. I got my question here.
Oh, nice. Did your homework.
But yeah, LinkedIn.
How did you find that out?
It was on LinkedIn. Yeah. It's like one of those, like when you're doing those live interviews like on Conan, and they're like, "How did you know that about me?" I'm like, "I don't know." Yeah. It was just for LinkedIn. Okay. Yeah. You went to France. Okay, very cool.
Moved to France and did research for this neurotech company called Tech, and we were doing EEG neurofeedback for children with ADHD.
Okay.
And so that at the end of that kind of 6 months working with them is when I was able to publish that research paper.
Very cool.
So I was essentially just doing research there.
Gotcha. And it's funny, so you lived in Paris and in like the valley outside of San Francisco, whatever that's called. And that's why you're a wine snob, because we went to a wine tour and you said you didn't like the wine, you were the only person that didn't like it, and you're from the two places like on the planet where people go to drink wine.
Yeah, okay, we're not.
We don't have to go to detail.
Public information. I'm not a wine snob, everybody.
Low key.
I love a good 2-bug check, all right?
She just didn't appreciate the wine. That's all I'm saying. That's all I'm saying.
Wasn't a huge fan of that particular wine.
That's true. That's true.
Yeah.
Okay, so you do all that stuff. We'll get to the company in a second. Why are you in Austin right now?
Oh, good question. It's funny. I think there's so many different reasons, and I can go through the analytical, like, okay, here's what made sense for our startup, and here's what made sense, from building my network, and here's what made sense for me personally. But I think a big portion of it is I just like it here.
Do you like humidity or no?
Not necessarily. It doesn't
Okay.
bother me, but it's more the culture, the people that are here. But honestly, if we go into why from a company perspective I moved here, our lead VC for the last round is based here in Texas.
Cool. Wait, who's that?
True Wealth Ventures.
True Elf Ventures?
True Wealth.
True Wealth. Gotcha.
Ventures.
Okay. I was like, that's a really weird name. It's like only Christmas investments that we're doing. Okay. Very cool. Okay. Do you mind disclosing how much you guys raised? Is that public? I don't know.
So total we raised about 4.5 million.
Okay. Very cool.
This last round we did 3 million, 2.8.
Okay. Very cool. Okay. So 4.5 million so far. What does that go towards with the company? Like, is that like you're going toward tons of R&D, tons like marketing? Like, what are you guys doing?
Yeah, so the angel round that we raised was really to get it out to market. So it was a lot of R&D. We're a medical device, so there's a little bit more capital that has to go into actually getting something to market.
Yeah.
Luckily, we're a class 1 medical device, so we don't have to go through clinical trials or anything like that, go through an FDA submission. But we do have to set up a basic quality management system and make sure that the documentation is kind of up to par.
What is the difference between a class 1 and like I'm assuming the next is class 2? Okay,
Yeah, so there's class 1, class 2, and class 3 medical devices. Class 3 is going to be the most invasive. Class 1 is the least invasive. A class 3 would be like an implantable brain stimulation device.
Okay.
Deep brain stimulation would be a class 3 medical device.
Okay, gotcha.
I'm pretty sure that a hip replacement, like when you're putting something in the body,
That's class 3.
that it's class 3.
Interesting, good to know.
And then I think anything that touches the body will be class 2, and then class 1 is the least invasive. So like canes, walkers, walking poles, crutches, those all fall under class 1.
Interesting. That makes it really simple to understand. That's good. Very cool. Let's cover what your device is. We have the device here. Should we pull it out here?
So yeah, what we actually do, sure.
Bam.
Take a bold new step.
So why didn't you choose WeStride? I feel like it was pretty close.
Well, we should have hired you as our branding team.
I was like, guys, we're so close. So why NEX and not like the T? Like, why'd you guys choose that?
I don't have a great story for this.
Okay.
But the question you should ask me though is why did we choose the name of the company, which is Oro Devices?
Okay, let's cover that. Why is it Oro? Well, that's my next question.
I have a really great answer for that one.
Why is it Oro Devices?
So my co-founder and I, we both went to Cal Poly. Which is in a small town called San Luis Obispo. Right outside of San Luis Obispo is this national park called Montaña de Oro.
Montaña de Oro?
Montaña de Oro.
Okay.
Like mountain of gold in Spanish.
Okay.
And it is the most amazing, beautiful place that I've ever been.
Wow, okay.
And it's one of those places where you go and you sit on the sand dunes and you watch the sunset.
Oh, it's like a beach park type.
It's on the water,
Okay.
and there's a bunch of sand dunes, and there's the water, and there's like cliffs that you can walk along the bluffs, and then behind it there is a forest and hiking trails, and there's like a campground there too.
I have friends that went there. I'll have to ask them about that. That's cool. Okay. Very cool.
It's a very amazing place, and it's one of those places that I would always go to be able to kind of get rid of stress and anxiety, and you sit there and you watch the sunset and you just feel so calm and confident and
I feel
happy.
calm to you talking about it right now. I feel like I was just calmed down. So the Oro stands for gold. Is that what it stands for? Wow, very cool.
And so that's what we wanted all of our customers to experience when they were using our devices.
So cool.
And we were always going to come out with, many different devices, which is why we didn't want to name the company the name of the product.
Very smart. Because that's what I was wondering too. Because I was putting your site together. I was like, do I call it Oro? Do I call it NexStride? So
honestly, we need to do a better job with that because
is Oro anywhere on this box or like?
Good question. Nope.
Maybe
well, right here.
There?
Oro Devices. Look at that.
I mean, they can't see it, but like that will just do a giant zoom in. Okay.
No, we focused on for branding anything that's consumer facing. We only brand NexStride.
Gotcha.
But when we are, talking to investors and whatnot, it's Oro Devices is the name.
Okay.
That we
and let's cover a little bit more on what your company actually does, and then I want to get to like Oro and like what future possibilities you guys have with other devices. So like, what does NexStride actually do besides have a very unique name?
Yeah. Can I take you a little bit down a rabbit hole to explain that?
Let's go through
to
it.
you?
Rabbit hole. Here we go. Yeah, there we go.
Okay. So when I was at Cal Poly,
you went to Cal Poly?
I know, yeah.
Okay.
Cal Poly, San Luis Obispo, Go Mustangs.
Okay, there we go.
So I had just gotten back from France, and I ended up meeting this local veteran named Jack Brill.
Okay, that's a veteran name. That's a cool name.
Yeah, so
Jack Brill.
He's a veteran.
Okay.
Who lived with Parkinson's disease, and he suffered from this mobility symptom called freezing of gait.
Okay.
So freezing of gait is one of the most common, it's one of the most debilitating symptoms of Parkinson's disease. It essentially stops someone from being able to walk.
Gotcha.
So, for Jack, it meant he was in a wheelchair all the time. Not because his legs didn't work, but because there's a specific neural pathway in his brain that was being damaged or disconnected that was making it so that when his brain was sending that signal to initiate movement, that signal just wasn't getting to the motor neurons that are activating his muscles.
That's crazy. Yeah.
Really, really fascinating symptom.
Yeah.
So as I looked into solutions for Jack, what I found is that we can use these external visual and auditory cues that essentially provide a goal for somebody to be able to walk over or be able to walk to the beat of like a metronome or walk over a green laser line. And just by adding a goal, you change the intention behind the movement. So my intention is to step over this line rather than to like just walk.
Yeah.
And that change of intention actually changes the part of the brain that's being activated and allows someone to be able to restore mobility.
Gotcha.
Does that make sense at all?
No, it does.
Okay.
So is, I mean, two questions. One is like, I'll ask one right now. Is it like a mental barrier? Not, I mean, obviously it literally is, but is it like, is it like a confidence thing that stops them from doing this? Or is it like literally something, is your brain like broken in a way? Or are you mentally just like, I can't do this? Like, what is
I am going to try not to go down too many rabbit holes because that's a really good question.
Yeah.
And a lot of people used to think that because they saw this, they saw this correlation, they used to think that it was kind of like a lack of ability, a lack of...
Yeah. Like you could go to a therapist mentally and just like feel better and do it again, like walk.
Yeah.
Like,
I forget what researcher it was, but there was some famous researcher that defined Parkinson's as a lack of will. But then they, did more research and found out that's not at all what's happening.
Gotcha.
So what's actually happening is, okay, so you have these dying cells in the brain in the substantia nigra.
Okay.
And they're dopamine creating cells.
Well, do I have those or like everyone?
Yeah, everyone has them.
I have dying cells in my brain.
No. Your cells aren't dying.
What? Okay. All right. Sorry.
Unless you have Parkinson's.
Oh, that's what I was asking. So I don't have. Okay.
Yeah.
I was
in people with Parkinson's, there's cells in the substantia nigra that are dying. Okay. Those are dopamine producing cells.
Which part of my brain? What are we talking about?
Yeah, I actually can't point to
okay. So, I was trying to visualize. Okay, cool. Okay, so the cells are dying in the substantia. Is that what you said?
Substantia nigra.
Substantia nigra. Gotcha. Okay.
Okay, so that means that you have a lack of dopamine in the brain, and that's essentially what causes all the symptoms of Parkinson's is that lack of dopamine.
And so, how do you get a lack of dopamine? Is like your life?
The cells that are creating dopamine are dying.
Okay, but how do you? Sorry, I just have so many questions. How do
okay.
you? This might be like the most kindergarten question of all time, but like, by being happy, does that help those from dying? Like, because obviously that's how dopamine's produced, right? Like, so what does that mean?
Right now, there is no cure for Parkinson's, so there's really no way to stop them from dying. The only thing that has been shown to slow the progression of Parkinson's disease is exercise, actually.
Because you're getting those dopamine hits, like from...
I don't really know why.
Okay.
I can't tell you why, but I can tell you it's the only thing that has been shown to slow the progression of Parkinson's disease. Okay, cool. So we have medication for Parkinson's that will cover up the symptoms, and those are essentially like synthetic dopamine that we're...
Gotcha. Like a melatonin kind of thing, put you to sleep.
Yeah,
kind of
it's like dopaminergic drugs, yeah.
Gotcha, okay.
Okay, hold on, where were we? I'm going too many rabbit holes.
Yeah.
Okay, so I was telling you about Parkinson's and the dying dopamine in the brain, or dying cells causes a lack of dopamine in the brain. And so what's happening with freezing of gait is when your brain sends that signal to initiate movement, that signal generally goes through the basal ganglia when it's being, which is a part of the brain, when it's being activated automatically. So automatic movement versus goal-oriented movement are activated in different parts of the brain. So when you're activating this automatic movement, it goes through the basal ganglia. The basal ganglia has a really hard time processing that signal because of the lack of dopamine in the brain.
Is automatic, is in like, I'm just doing this right now? Is that kind of what? Or... Yeah,
like, I don't know. How do I just explain an automatic movement? Like, okay, if I were to, yeah, exactly, just kind of like put my arm out versus like something you're not thinking about. It's not conscious.
Yeah, like you're just washing the dishes kind of thing. Yeah.
Versus saying, okay, I'm going to reach for that thing. Like I'm going to reach for the back of your chair.
Yeah.
It's the same exact movement with my arm, but it's a different part of the brain that's being activated in order to initiate that movement.
Cool. Okay.
So that's essentially the, knowledge that we're using to be able to create this product.
Gotcha.
So long story short, we figured out we can use these visual and auditory cues to activate goal-oriented neural pathways in the brain that allowed someone to be able to overcome freezing of gait, which is the symptom of Parkinson's that stops people from walking. We took the most effective visual and auditory cues from research, combined them into a small portable device that could attach onto any cane walker or walking pole, and brought it to market.
Very cool. So what you said was there's the automatic and then there's like the intentional, and those go through two different pathways.
That's correct.
So what you're saying is like when I want to walk, I don't naturally just think about it. I'm automatically just walking because that's like part of my normal movement.
It's unconscious.
And you guys ignore the weird word and then you go the other way. What was that word again? Starts with a B? Basal something?
Oh, the basal ganglia.
Basal ganglia, yeah. So you ignore that one, and so through these like rhythms and whatever you're adding, like noises or lasers, what you said, you're creating it as like a manual initiative, which pushes it towards a different pathway. Is that what you're saying?
That's correct. So essentially, okay. I mean, you're invited to Texas
Let's
Neurotech now.
I'm taking your job, 100%. Yeah, NexStride. Yeah. Okay, so what were you saying though? Sorry.
I don't remember. Oh, essentially what we're doing, right, is just changing that movement from being automatic to goal oriented. So there's a number of different ways we can do this. All we did was take the most effective visual and auditory cues from research, and we combine them into this device that can attach onto any cane walker or walking pole. So the visual cue that we use is a green laser line projected onto the floor in front of you.
Okay.
The auditory cue is a metronome.
Gotcha.
So you try and step over that green laser line, or you step to the beat of the metronome. And again, that change of intention changes the part of the brain that's being activated and allows someone to be able to walk again.
So cool.
It's honestly crazy.
That is so my question is like, if I'm mentally thinking I want to walk right now, why isn't that going into the manual side already? Like this is yours. Okay, so if I'm just walking, it's automatic.
Yeah.
But if I can't really walk that well, and I'm like, okay, I want to walk to there, shouldn't that be on my manual side, or is that on my automatic side still?
That'll be goal oriented. So if you say like, okay, there is a door over there, I'm gonna walk. It's gonna take me 10 steps to walk over there. That is an internal cue that people can use for Parkinson. So there's a number of different ways to overcome freezing of gait, and external visual and auditory cueing is just one of them. The reason that this is so effective is, one, it's proven to be more effective than any other cueing. These visual and auditory cues have been shown to reduce falls by 40% for people with Parkinson's.
Very cool.
But two, I think there are a lot of internal cues. So you're right, setting a goal yourself. There's other things you can do like weight shifting. Anyways, we can go into the list.
Yeah.
But the hard thing is, if you're stuck in a spot where you're walking totally fine and then all of a sudden you freeze and you're about to fall, like, are you really going to remember, oh, my physical therapist 3 weeks ago told me this thing to remember? What was it again? You're in a panic mode and you need to be able to just like press a button and start walking again.
So then also, are they pushing a button and walking again, or is this a constant thing that is like part of their life, where when they want to walk, they have this like kind of thing that just keeps following with them?
Yeah, so there's different ways you can use it. There's continuous cueing or on-demand cueing. Okay. So what you just described is continuous cueing. Okay. So there are some people that every single time they're walking, they have either the visual or the auditory cue or both of them on.
Gotcha.
Like anytime they get up. And what that will do is it will prevent freezing of gait episodes from coming on in the first place.
Cool. I like that.
What other people will do, if maybe, they don't experience as many freezing episodes,
or they're cocky,
well, a lot of people are very self-conscious about bringing attention to their disease, to their disorder.
Yeah.
So if you don't want to have a laser sticking out of your cane or your walker all the time, what other people do is they use it on demand or as a rescue cue. So you become frozen, you press the button to activate either the laser or the metronome or both, start walking, turn it off again.
Is there a way you guys could eventually make it so that like your glasses can see the line, but like you're not personally shooting the line out for everyone to see?
Yeah, it's funny. We've actually gotten that question multiple times, and there is one research paper that was published using Google Glasses to overcome freezing of gait.
Yeah.
I think the issue with it was, one, the usability. It was a lot harder for people to figure out how to use them, and I'm sure we could create something simpler, but it just wasn't shown to be as effective, and so we wanted to keep with at least the minimum viable product getting out to market. We wanted to stick with the simplest, most effective version.
Oh no, that makes sense. I was just curious, like as far as like future plans go or something like that. And speaking of market, who are you guys currently working with? Are you in retirement homes? Are you like in like 1,000 homes in America? Like where are you guys at?
So we sell direct to consumer.
Okay. Is that your biggest market or?
Yeah, so our biggest area right now is direct to consumer.
Okay.
We also sell to the VA. That's our second biggest customer.
What is that, like Veterans?
Veterans Affairs.
Oh, Affairs. Gotcha.
Mm-hmm.
Okay.
So any veteran can get this device for free right now.
Oh, what? Wait, how does that work? Like you guys revenue wise, are you just donating it or they
No,
insurance?
the VA pays for it.
So
the VA will place an order with us directly.
Any veteran can get this for free?
Any veteran who gets healthcare through the VA can get this device for free right now.
Very cool. Okay, sorry, keep going.
Yeah. So direct to consumer, we sell through the VA. We sell through some distribution partners. So right now we sell in 7 countries, including the US. So we have distributors outside of the US, and we are about to close a really exciting deal with a distributor in the US.
So is that like relatively soon? Every time I do a podcast, they're like, tomorrow. I can't tell you today, but tomorrow. Yeah. And I'm like, fuck. So how much time do you think before you're gonna get that deal closed? Because this airs in like a month, so.
I think in like a week.
Okay, we'll put it on. We'll put it on the screen. There we go. Cool. Okay.
It's very exciting though. I mean, I don't know. I don't know if anybody who's not in the medical device space would know this name, but anybody who's spent any time in the medical device space, they're like a Fortune 10 company. So we're excited.
Just Google Fortune 10 company and you'll find it. That is incredible. Well, I don't know I probably won't know who they are either, but I'm very happy for you.
Thank you. We're really excited.
Okay, so we have consumer, we have direct partnerships. Yeah. I keep interrupting you, so that's my bad.
No, you're good. This is what happens when you get like 2 people with ADD in a room.
Literally.
You're like, you cannot
100%.
stay on topic.
Like a whiteboard, just like,
okay, so we sell direct to consumer, we sell to the VA, we sell to distributors, and then we sell to hospitals and physical therapy clinics.
Okay, cool. Wait, how big of the market is the hospitals and physical therapy right now, you think? Of our revenue? Sorry, not market.
Honestly, it's a very small amount because they move very slowly.
Interesting, okay.
So, for example, we sold to like Cleveland Clinic is a big one. It took us, I think, 6 months to get through their like vendor approval form like process that they go through. And for us, like at our price point, unless they're ordering in bulk, it just doesn't make sense to pursue that.
It's too much time,
as one of our kind of main channels. But we do, right now what we do is we're going after direct to consumer. And we use this kind of B2B through clinics and hospitals as kind of a way to supplement that. Because it's really important to us for people to be able to hear about the NexStride, go into their physical therapy clinic, see their physical therapist has one and is using one and loves it, get that validation, and then purchase it.
Yeah, you're right. That is worth it. Sales, regardless of sales, that's worth it just for the validation for sure.
Because that's generally the journey that our customer goes through. Is they find out about us through some ad, through, we work with like Parkinson's foundations to get awareness out. And then they go into their physical therapist or they talk to their medical professional and say, hey, have you heard of this thing? And when their doctor says, no, I've never heard of that, then they're like, okay, well, this must just be a gimmick.
Gotcha.
But if they go in and they see that their physical therapist is using it and has it and uses it in training, then it adds a lot of credibility for us as a new product on the market. Yeah,
that's all. So are you not working with any nursing homes then? Is that not part of the...
We actually just finished a pilot study with Paragon Management, which is, they have like 40 skilled nursing facilities in New York.
Cool.
So we're just starting to kind of get into that space and having conversations with one of the big distributors in that space too.
Yeah, I can see that being huge. I mean, like, especially with the baby boomers all heading into nursing homes right now. I mean, honestly, any of your target markets are going to be big. Yeah. So it's like...
Yeah. The reason we hadn't pursued that earlier is that, such a small percentage of those people have Parkinson's.
Gotcha.
That they're not super motivated to buy products like this or have them on hand. But we're just starting now to expand into different disease states. So I told you this whole story about Jack and why we started the company. And once we got the device out on the market, we realized really quickly that it's not only effective in Parkinson's, but it's also effective in stroke and cerebral palsy and multiple sclerosis and PSP and traumatic brain injury and a number of other mobility disorders. So we're starting to expand and redo all of our messaging to go after that broader target market.
Gotcha. Okay. And is that going to be a different product or the same NexStride product?
Same product.
Okay.
Yeah. So we just published a case study with Bellevue Hospital actually using this exact product in stroke rehab.
Oh, wow. That's awesome. Yeah. I could, is this like a product that would be like on like a late night commercial or like for people of that age buy these things? Like,
honestly, yeah, we're starting to test that out.
I was gonna say,
DRTV is one of the most effective ways.
What was it called? Sorry.
DRTV, direct TV.
Oh, gotcha. Okay, gotcha.
Direct response TV, I think is what it stands
okay.
for. Is one of the most effective ways to get to people over the age of like 65, 70.
Yeah.
Which is crazy because like, nobody under the age of 50 has cable.
Exactly. Well, your product isn't like a gimmick, which I feel like most of those products on that show or on those late night shows are, but at the same time, it's like, you know, who cares? Like if they need it and they're the ones watching it there, they might as well sell it on there.
No, I know a lot of companies that do, like there's this company Ember Labs that does a product for women who are going through menopause. They sell on DRTV. Inogen is a public company that sells like products for people who need oxygen.
Gotcha.
And they sell on DRTV. Like,
just crushing it.
It's honestly a lot of these like age tech companies do really well with direct response TV.
I'm excited to see how that goes. So the back to Parkinson's really quick. So is Parkinson's kind of like a category? And then there's like deep gait. Was it deep gait or what was it called? What gait? I totally forgot.
Freezing of gait.
Freezing of gait.
The
I don't know
symptom?
what that deep gait. Like
you mixed a deep brain stimulation with
I
freezing
think
of gait.
I did. Yeah. So is Parkinson's the category, and there's like 10 different things that can happen underneath Parkinson's, or like or are those all just symptoms? Like how does Parkinson's work?
Yeah, so Parkinson's is a mobility disorder.
Okay.
So it's a neurological disease. It's a progressive neurological disease. So once you get diagnosed with Parkinson's, there's no cure.
Gotcha.
And you're just going to get worse.
Gotcha.
And then there are a number of different symptoms within Parkinson's that you can help with. So there are mobility symptoms. There's like voice therapy is a big thing for Parkinson's because they lose their voice. All of these automatic things. So it gets hard to talk. It gets hard to walk. It gets hard to swallow. It gets hard to breathe. Like all of these things that are automatic become very difficult for somebody with Parkinson's.
Interesting. And where is research at right now? Like, is it like, are we, I don't know how to ask this. Like, I don't know if you know either about it. It's like, where are we at with research, I guess?
It's so funny because you can go back 10 years and you can go to the research articles that have been released in the past year. And they always say, we're almost there. We've almost figured it out. We're right at the brink of finding a cure for Parkinson's. But there are hundreds of millions of dollars going into Parkinson's research every year.
Yeah, that's cool. Are they just going towards, is a lot of that going towards rehabilitation, or is it going towards like solving or curing Parkinson's? I mean,
so most of it is going towards actually finding a cure, which I think is a very noble cause, which I think is really important. But something that's really frustrating is, I see that and I think it's fantastic.
But for the time being,
what about all the people who have Parkinson's right now?
Exactly. Yeah,
who is spending money to find them tools?
The Oro is. We out here.
That's something that I really like about the Davis Phinney Foundation is that they're really focused on people who are living with Parkinson's today. What can we do to help them?
That's awesome. Well, I love what you guys are doing. I mean, regardless of it, it's a cool product too, but like it's obviously for like a really good cause. Do you guys work with like, I think of like so many like charity organizations, or you guys can have your own at some point. Like, is that a goal for you guys to like also like raise like a fund to go give back to Parkinson's or something like that, or does it just help your? I don't even know how to ask that. I don't know.
We do. So we partner with a lot of Parkinson's foundations,
so cool.
And I would absolutely love to get to a place where we can, do like 5% of our profits go back to this organization.
That's really cool. Yeah.
Right now, the way that we do it is we partner with an organization called the Parkinson's Wellness Fund. And so they will fund, they'll give a grant for anybody who needs financial assistance to be able to get the NexStride. So they'll pay for someone to be able to get the NexStride.
Cool.
But the way that we work with them is that we discount it on our end. If they qualify somebody and say, okay, we're going to give this person a grant, we discount it on our side and they put in money to help get the person a product. So
cool.
Like that's the way that we work with them now. We, volunteer with a lot of different Parkinson's organizations. Like I actually host the Parkinson's support groups here in Austin.
Oh, cool.
At the Capital Area Parkinson's Society.
Is that for people that have Parkinson's or people that are like married to someone with that or something like that?
It can be either. There's a lot of people with Parkinson's who come, but spouses and children and whatnot will come to learn about it as well.
Okay, gotcha. How long has this product been out for, like the NexStride specifically?
So we kind of got the beta version out. We did like a soft launch in April of 2020.
Gotcha. Oh,
so
yeah.
like right at the beginning.
My birthday right there. Yeah, it was a great time to have a birthday.
So right at the beginning of all the shutdowns and whatnot. So it was a little bit of a shit show trying to figure out, like we had this whole like beta launch strategy of like, okay, we're going to go to all these in-person events. We're going to go to all the support groups and whatnot. And then COVID hit and all of that went to shit.
So. And the audience you're working with was the most like at risk. So you're just kind of like, fuck. Like, what do we do?
And the least technologically savvy.
Yeah.
So
you have to be there. Yeah.
So a lot of support groups now have figured out how to be on Zoom, but at that point was not really an option. So people just weren't meeting, and
wow, that's tough.
We had to rethink everything.
What'd you guys do for those months? Just kind of like work on the product more, or like what do you even do when your audience can't be reached in person, kind of a thing?
Yeah, so we definitely cut spend substantially. We were planning to do this big kind of marketing push to kind of test out some different strategies of what was going to be effective in our long-term go-to-market. But we cut that substantially with everything that was happening, and we decided to just do a lot of smaller, cheaper tests.
Okay.
So we did a lot more digital ads. We did like Facebook marketing and
how'd you like that?
Google ads. It was pretty effective.
Okay.
What I really liked about our Facebook ads is that people would see our ads and they'd start commenting on it.
Oh yeah, especially that demographic.
Yeah, and then they would have full conversations with each other. It was really cool to see.
That's interesting.
You know, like I remember one time one of our customers commented on it and was like, "I have this and I love it."
Nice.
And then we've had one of our PTs comment on it and be like, "Yes, I refer this out to all my patients."
So cool.
And then sometimes we just have people comment on them saying like, I have Parkinson's and I don't know what to do. And then somebody else will comment and be like, have you tried this support group? And then somebody else will comment and be like, bring these questions to your neurologist next time. Like, it's such a cool community. You know, like people really want to help each other.
Do you guys have a digital community, like a Facebook community or something like that, like a Facebook page?
We tried
I tried it too. People have really good Facebook communities. I tried it.
So we tried to do it with physical therapists. We haven't done it with consumers, but we tried to do it with all, because we're in like over 100 physical therapy clinics across the U.S.
Very cool.
And we get a lot of questions of like, okay, well, what do you do when the patient has this symptom? What do you do when the patient has this symptom? Like, I can quote research to you, but I am not a physical therapist.
Oh yeah, you should not be the one like exactly.
So I tried to get them all in a group together, and I'm like, okay, ask each other these questions.
Exactly.
Turns out it's a lot of work to get people to actually interact in the Facebook community.
It's tough, and like honestly, Facebook's just getting worse and worse too. Like their groups used to be able to post into, like if you had a page, you could post on the page and everyone would see it. And now when I post on my page, I get like 40 views from like my family that follow it. I'm like, I don't even use our Facebook anymore for business. So, I mean, it used to be good though. It used to be good.
Yeah.
I don't know if you mentioned this. Does insurance pay for your product in any way? Are you guys working towards that?
Yeah. So we're not covered by insurance right now.
Okay.
And what's hard about our product is that we have, we don't fall under any billing code. It's called the HCPCS code. But we don't fall under any billing code because we're not a cane and we're not a walker. We're this device that attaches on to canes and walkers. And the great thing about this product is that nobody's done it before. The terrible thing about this product is that nobody's done it before.
Yeah.
And so there's no like code that we fit under. So it is a long process. And we are going through that process. We've had many conversations with CMS. And in the meantime, it is really important to us that anybody who needs this product can get access to it, which is why we partnered with the VA, so any veteran can get the device for free, and then we partnered with the Parkinson's Wellness Fund, which again will cover the cost for anybody who needs financial assistance.
I love that so much. That's so cool. Yeah, I feel like, that's annoying to have to create your own category. I was talking with someone yesterday, I was talking with the Fetty guys, the bands,
Mm-hmm.
Hey, you're in one of them. We did the wine tour.
Yeah. I know, they're great.
The one you hated. No, I'm just kidding.
I loved the wine tour. It was great, you guys.
She loved the tour. The wine is just not her cup of tea.
I feel like the winery is going to listen to this and I'm never going to be allowed back there.
Well, they don't, there's no way they're going to associate that. We've done 40 wine tours. You don't know which one it was. But no, so we had them on here and they were talking about like, I was asking them if it's like how it's been legally opening up in different cities, and they're like, well, Uber just cleared the path, so we can just like open
nice.
up, and it's like the paperwork might as well already be done for us. So that is annoying that you do have to kind of like create your own rules and kind of like figure out if things are working or not. Interesting.
But that's the fun of a startup, right?
The fun of it's the quote fun of the startup. Yeah, exactly.
And creating a little bit of a new market here.
Exactly. Yeah. And speaking of like the fun of a startup, like what is your like day-to-day role, and then what's your team comprised of, or who's your team?
So my title is CEO and co-founder.
Okay.
Means everything from putting together a grant proposal to fundraising to being on podcasts and being the face of the company,
exactly, yeah.
To speaking on panels and being at events, to I don't know, what else do I do? I get really in the I always mess up when I'm trying to say phrases.
In the weeds?
In the weeds. Thank you. I was going to say in the ground, and I was like, that's not right.
That's terrible. You don't want to be in the ground, so everyone knows.
I get really in the weeds. Right now, our biggest focus is really understanding our customer acquisition cost to the point where we can scale it and reproduce it in a cost-effective way. So I get really in the weeds on that right now. I'm in all of our sales and marketing calls trying to understand as much as I can about the space. Being an engineer, science background, like there's a lot I don't know.
Yeah, no, every day you're gonna learn something new with that space. Yeah. It's like crazy. Do you feel like, because I have this problem so terribly as a CEO, I'm doing a bunch of shit I shouldn't be doing constantly.
So I had to really reevaluate that when, as soon as we closed our last round, we brought, 3 people on board. And we went from me and my co-founder full-time, 1 person part-time, to 6 people on the team.
Okay. All in Austin or just like remote or what?
Remote all over the place.
Okay, gotcha.
Which was a huge change. And it went from like William and I doing everything to me having to completely change my role. Like 100%. To the point where I had to like really sit down and be very kind of thoughtful about it. Like, okay, what is my role now, and what does it mean to be successful in my role? Because it's not sitting down and grinding out as much work as I possibly can. It's much more strategic, and it's much more, forming relationships and thinking about how the team as a whole can be productive, and how to make sure that everybody's very clear on what their goals are and what they need to get done, and they have kind of the authority in their own domain to be able to make decisions and move quickly.
Yeah.
And so that was a complete change for me.
What tasks that you used to do you not do anymore because you hired people?
So a great one is I was the contact for all of our physical therapists.
Okay.
So I was the person that
right now.
reached out to them, and I did their in-services, and I followed up with them monthly. I was the contact person. And that's now either Harshini or Paul are
Gotcha.
salespeople.
Well, that's really important too. Like, I think that's the biggest mistake that startups make, is that you're not that person initially, like for whether it's financially because you couldn't afford to hire someone else, or just because like you just decided not to. Like, I think it's important to like be that person that your initial customers are talking to, because you get to know your initial customers, you get to know what the problems are like on a first-hand basis. Like, it's just important.
It's hard to take a step back.
It's
I feel
hard.
so
hard.
Disconnected.
Yeah.
But I also have a lot of trust. Like, Harshini is the most amazing, like, just rock star employee ever.
Love that.
Where I 100% trust her opinion on things, and I think that she does a much better job than I ever did.
Nice.
And so she's made it really easy.
Gotcha.
It's hard to take a step back because you feel so far away when you were the person talking to everybody and understanding every single thing that was happening in the company, to like going up one level in terms of like what you're looking at. And having to trust that your employees and the people that your team is gleaning the information that they need to from their interactions with our customers.
Yeah. No, it's tough. I mean, I've taken a step back a little bit. Like I've had a person take over, but like I have 2 calls with some big gyms tonight, and I'm like, I am taking those calls. Like I 100%. So I'm moving towards where you're at, but I'm not there yet mentally. It's a mental thing for sure. I could hire someone to do it, but I'm just like, I don't know. It's just, it's my heart right here.
Yeah.
Very cool. So what does your co-founder do? What is his role? You said William, right?
William.
Okay,
Yeah.
Okay. You said William.
William.
You said like an 80s movie.
Man.
William.
He's so funny. So his full name is William T. Thompson III.
I love that so
Okay.
much. Okay.
His middle name is the letter T.
Oh, actually?
There is nothing else there.
William T. Thompson III.
I think it is so funny.
Yeah.
When we were doing due diligence with our VC, I remember Sarah and Carrie reaching out to me and asking for our full names to do background checks and whatnot. And they're like, can you give us their full name? And I sent them William T. Thompson. I had to like put in parentheses.
The third?
Yes, his middle name is just
gotcha.
T.
Oh,
and it made them laugh.
That sounds like a name you'd give like a cop when you were drunk or something like that. So you didn't want to get in trouble. William T. Thompson III.
I think it's so funny.
Wait, so what is his role in the company?
So he's much more operational.
Gotcha.
So he handles everything from like making sure that our business is registered in Sam's and making sure that, you know, it's like all of that kind of logistical stuff.
I need one of those so bad. Oh.
And then he does all of our financials. He does all of our like taxes and stuff like that.
I need one of those so bad. I'm gonna get me a William T. Thompson III.
Yeah, you definitely should. I mean,
seed.
don't take mine, but you can get another one.
I'll get a Bill T. Thompson III.
Yeah, that's his dad.
Oh.
The second though.
Okay, was his dad looking for a job? Okay, very cool. So, I know you do have something that you have to get to relatively soon. So I want to ask two final questions here. One is like, what's next for the company? And then the second one, which might be related to the first one, is what future products do you see kind of down the horizon?
Yeah, good question. So, I mean, the first thing, which I kind of touched on already, is just sales growth. Is really spending the time to understand who are our customers and how can we get to them in a cost-effective, scalable, reproducible way.
Okay.
So that is our number one goal right now. And that includes expanding outside of Parkinson's and going into stroke rehab and multiple sclerosis and cerebral palsy and PSP, and traumatic brain injury and a number of other mobility disorders. So we're redoing all of our messaging to be able to be more inclusive of different mobility disorders. The next step after that will be bringing on new products. Mm-hmm. So the next product that we're in development for right now is basically a belt-attached version of this product. So it'll have the same visual and auditory cues, but it'll be attached onto the body for people who don't use canes, walkers, or walking poles.
Is that a stage 2 though?
A class 2 medical device? It shouldn't be.
I don't know, based on my knowledge that I learned in the last hour, that might be a class 2. I'm just saying. Guys. They're all thinking it too. So like, it's a class 2.
So just this that like attaches like with a belt clip onto the body wouldn't be a class 2. What we need to think about is like data collection, what data we're collecting, how we're collecting it, because that might make it a class 2.
Would it be a class 2 if it was like on your arm? Is that, because I think that was what I understood. I'm
just going to go ahead and say I'm not an FDA specialist.
Okay, fair enough. I thought I had the classes down, and now I'm like, maybe I don't have the classes down. Okay, sorry, keep going. Okay.
I'm not a lawyer. None of this is legal advice.
Okay, fair enough.
I'm not a doctor. None of this is medical advice.
Not a physical therapist.
I feel like I need to like put all the PSAs out there.
We'll have a giant thing that pops
Please
out.
don't sue me.
Okay. So you're going to do a non-class 2, probably class 1 on the belt.
So non-invasive mobility solutions is kind of umbrella is what all of our products will fall into. The next one will be a belt-attached version of this product. We're moving towards data collection as well. So being able to collect that mobility data, feed it back to the physical therapist or the medical professional.
Is that like an Apple Health sync up, or what is that? Like, or like something that
No,
you guys create?
So we would create that. We would put the sensors in our product.
Okay, interesting. Sorry, really quick, do you guys have competitors? I know you're the first to like do like this space, so
there's one other company in the US who makes visual and auditory cueing products,
Okay.
and they're called InStep Mobility. They have a product called the U-Step that is a walker that integrates the visual and auditory cues into it. So
gotcha.
it's actually a great walker. And we have some customers who have the U-Step and have the NexStride.
Damn, double up, okay?
Because
Okay.
it is a really great product. However, it's a great product for a specific purpose and for a specific kind of type of person. When I say type of person, I mean like the stage of their mobility and where they're going to be moving. However, it weighs 32 pounds. You know, it costs over $800. And so Sandy, Jack's wife, couldn't lift it in and out of the car. So he would walk around with U-Step around his house, but whenever he left his house, he couldn't walk. He was in a wheelchair.
Interesting. Okay. Wait, how much does yours cost?
Ours costs $499, about $500.
Okay. And how much does it weigh?
How much is what?
How much does it weigh? How much does it weigh?
Less than a pound.
Less than a pound. We can carry that. Okay. Very cool. Okay.
Yeah, so our device, what's really different about our device is that it attaches onto any cane walker or walking pole. So one, that means you can walk in with whatever mobility assistive device you're already using, and that can be very personal to people, you know, whether you're using walking poles or a cane or a walker. There's lots of different kinds of canes and walkers.
A stick, like in the movies, they get a stick. And there you go. Yeah.
Exactly.
There you go, yeah.
So there's lots of different types of mobility aids that can be very personalized to the person. But the other reason that this is important is because it actually allows for somebody with Parkinson's, as their mobility progresses or changes, they can move this from a cane to a walker to walking poles back to a walker.
Cool.
So we've had a customer that started using the NexStride when he was using a walker. And then he started going to physical therapy and he went to using walking poles. Then COVID hit and he went back to a walker, and then he started using a cane, and he could use our device consistently and have access to those cues consistently as his mobility changed.
So cool. I love that. Well, that's awesome. I probably could ask you a lot more questions, but I know you have to get down through Austin traffic to UT. So this was so amazing. Episode 7 or 8, I'm not sure yet. We're gonna figure it out. TBD. And we're probably gonna have some interesting news that you're gonna come out with very soon. So I'm excited to add that to the podcast.
Yes,
Maybe
we're
we'll have
very
you like
excited to announce it.
Yeah, we'll have you like FaceTime in and add. Look, we did it. We'll put it. That'd be really funny. So cool. Well, it was awesome to have you on here with the press release. Yeah, exactly.
Exclusively on WeStrive.
TMZ. So it was incredible to have you on here, and we finished with That's Why We Strive.
Thanks, Corey.
Then you gotta do it too, though.
Oh, I'm sorry. What do I say?
That's why we strive.
That's why we strive.
Cool. Pleasure.
Thanks, Corey.
I wanted to thank you for watching this entire episode of Why We Strive. Be sure you head to whywestrive.com and subscribe, so every Tuesday you can see incredible interviews with some of the best tech founders, investors, and creatives in the industry. Have an amazing day, and don't forget to keep striving.